Hey guys, what's up everybody, and welcome back to House of a Warrior. My name is Lorraine Adoyo. If you're new here, karibu sana. If you're an old member, thank you so much for coming back to watch another video. Please keep telling a friend to tell a friend to tell another friend to check us out, and let's fill this house up. Okay, so gosh, I've not even started. I already have drama going on, but today I want us to talk about a very sensitive topic, which is around blood transfusion, but to people who have sickle cell or who are in a very dangerous medical situation but cannot receive blood. Okay, by cannot, I mean like there are compromises, either religious or with their blood type or such kinds of things. And the people that I know with this going around in their culture are the Jehovah Witnesses people. So today we're going to be talking about non-transfusion management for Jehovah Witnesses individuals with sickle cell disease. Okay, you guys, this is a very serious topic, because for a warrior, blood is one of our treatments, and we get blood often and a lot, and it actually saves a life sometimes. You know, our blood count goes so low to the point that only a transfusion can help. You know, like no amount of supplements you can take that can bring it back up to where it's supposed to be, no amount of healthy fruits and vegetables you can eat that can bring it up as fast as a blood transfusion can do it. So can you imagine if I tell you that some Jehovah Witnesses, I don't want to say all, but some Jehovah Witnesses, especially adults, would rather die, like literally would tell the doctor, I would rather die than receive blood. Okay, this is just not something they come up with. This is mostly because of their religion. Okay, their religion forbids actually the receiving of other people's blood or blood in general. Another thing that could hinder someone from receiving blood is severe immunization. I wrote it down. This topic, I got it from a study. I joined a Zoom meeting where they were talking about substitution treatment for Jehovah Witnesses that do not include blood transfusion. And I joined that Zoom and I got to learn a lot, you guys. I got to learn a lot. So other people who cannot receive blood are people with severe alloimmunization, which just means that they are not compatible to any PRBCs. Like there's no blood on earth that they could be compatible. You guys, first of all, I just want to put a disclaimer out there. Just first of all, I'm not a Jehovah Witnesses person, and secondly, I'm not a doctor. This I got from that Zoom meeting. I could be wrong, but I just took pointers from what their doctor was saying, because there were doctors on that expert panel list, and these are pointers that I got from them. So please do your research as well. Do not just rely on what I am telling you. This is just coming up from another person's knowledge. Okay. So like I said, there are adults who choose that they would rather die than get transfused. As of children, because Jehovah Witnesses also have children, and their children sometimes are in serious conditions where they need blood, especially sickle cell disease. Some doctors have actually gone to the extent of getting a court order just so that they could save a life of this child, you know, when the parents have insisted that no, our child is not receiving blood, you know, like as opposed to the adult, where an adult can advocate for themselves and say, you know what, I don't do blood. A child cannot, you know. And in terms of a medical situation, the doctors, what is it called, this thing that they take, what is it called, whatever it's called, their mission is to save lives. And so when it comes to a child, sometimes they have to go to the full extent of the law and even get a court order. Okay, so Here are some of the risks that a person could be in, and in this case a Jehovah Witnesses a person, and some of the intervention that could be used to save their lives. So in case of an infection, mostly a blood infection, in case of a acute chest syndrome, these are scenarios where if you're a warrior you would need blood transfusion. So they would intervene with antibiotics, they would intervene with breathing treatments, sometimes maybe oxygen, but most importantly maybe transfusion, which is what this particular patient would not. I'm sorry guys, my flu is not completely gone. In this particular scenario, the patient is not willing to receive blood. So those are the other types of interventions that they will try and use. In case of a stroke, because a stroke is one of the many things that us as warriors have to always go through. Now the only other way they could intervene is just have a neurosurgeon on board and have neurosurgery, but also, the probability of a transfusion when you're in a stroke, a sickle cell disease induced stroke, is a probability of transfusion. So given that they cannot do this, they will just have to monitor their brain and monitor their vitals, but there's nothing much they can do. When you're getting when you have to go to the theater, most probably you're gonna be you're gonna have to go through a transfusion, because when you're under anesthesia and you need all these things going for you, you have to go through transfusion. And this is where I learned from that meeting that some of the adults that are Jehovah Witnesses do not even agree to go anywhere near a theater. That is why, sorry, my first point was that these people would rather die. Like the doctor said, his name was Dr. Lewis Hughes or something. I will confirm that down below. He said that most of his patients have told me, no, you know what, if this is my end, then this is my end. I'm not doing that, Okay, so another risk comes when you're pregnant. In pregnancy, you get clots, you're in pain, there's pre-eclampsia, guys, I can see because of the light. There's acute chest syndrome when you're, probability of acute chest syndrome when you're pregnant is really, really high. There's miscarriage, you could have a miscarriage. There's prematurity, there's all these things, especially when you're pregnant, that would make you need a transfusion. But then now what do the doctors do? It was a very, very, very heavy topic. I can't imagine being in that situation and my religion forbids me, all these conditions. When you're pregnant, you would need to have a transfusion, not only for a sickle cell disease person, but for any other normal woman pregnant and you are having a miscarriage. Your child came in too early, you are low on iron, your baby is low on iron, there would be a need to transfuse both of you. What do? Disease modifying medication, that is one of the other things that the doctors run to, which is hydroxyurea. Hydroxyurea is taken by mouth. It is an oral medication which is given from 9 months of life to however old you are, and other FDA approved medication that are for sickle cell. These are the only disease modifying medication that they can use instead of blood transfusion. Hydroxyurea does a lot for our bodies. You would need to take drugs that would make more red blood cells for you. In this case, you would need to take a lot of iron, which could be found in folic acid, which is a supplement that us guys take daily. You would need to be on a very, very good diet so that your HB is always at a good level. you should need to reduce blood loss, like things like injuries and stuff. You cannot be careless. You cannot afford to lose even one drop of blood. If you are in this situation of, no, I cannot receive blood, and you are a sickler, then you will need to take really, really good care of yourself. You cannot be found on accidents. You cannot cut yourself. You will have to, like, really, really be careful. 24 hours a day, 100% of the day, you need to be really, really careful and take really good care of yourself. You would need to be on hormonal management, especially this is for women, especially during periods. You should need to be able to make sure you're preventing yourself from getting into infections, because infections leads to a host of other things when you are a sickle cell warrior. A simple infection could lead you into a stroke. A simple infection could drain you out of all your blood in your system, like, I kid you not. So you need to really, really be on top of your health, which is what we were talking about last time. Like, plan your health calendar this year, and so that you are on top of every single thing. You would need to have your checkups every single month. Like, you cannot miss a visit to the doctor, just so that they know you're doing well, they know you are not at risk of getting into anything, they know that they can prevent whatever it is that could be coming on, just so that you do not go into a situation where you need to be in the hospital, and then where you need to receive blood. Okay, so there's, like I always say, there's treatment for sickle cell, which is really, really good news, especially for someone who would be in this scenario. There's gene therapies, there's transplant options, there's new FDA ones that have recently been approved, and some people have already gone through them and tried them. I always say I wouldn't take the treatments for myself. I wouldn't go through that, because I feel like it's really, really hectic. First of all, it's very, very expensive. Also, getting a bone marrow transplant leads to get a donor who is like 110% your match. There's no shortcuts where that is concerned. So that is really, really good news for the people who would be going through this, I feel like. But all in all, sickle cell, it's not just about the pain. Apparently, I learned, for many years, I always thought it's just about the pain and what the pain comes with. But the pain is just a minute, it's a very small fragment of sickle cell. There's all these other things that people get to deal with on the side that even I, as a sickle cell warrior, did not know. Yes, I knew there's like some sort of religious thing when it comes to other people, but I did not know it was this serious. I did not know a grown person would actually decide on, what, I'd rather die. I did not know it was that serious. I did not know a doctor would need to go and get a court order just so that they can treat someone whose parents' beliefs are different from science or from... I did not know that. So it's actually a lot more than just the pain. So yeah, that was our topic today. I hope you learned something. I hope you can put yourself in someone else's shoes. Let's not be quick to judge. Let's always research and always think of other treatment options for other people or even yourself. Just because we have hydroxyurea, it could be working for me but does not work for someone else. Always think of painkillers. I don't know, painkillers that could be stronger than what you're using, that could help eradicate your pain faster. Always let's always just engage. Let's always talk. It helps. And me just always trying to join these Zoom meetings that randomly pop up on my feed to educate myself first and foremost, and also to come back here and also share with you the little that I know, which will in turn trigger your curiosity, I hope, and make you also just go and do some research of yourself. Okay, so that's it for today. Thank you so much for watching, you guys. let's keep the momentum going. I'm gonna try and keep posting every week. Thank you so much for watching. Please keep telling a friend to tell a friend to tell another friend to check us out, and let's fill this house up. And I will see you guys in the next video. Bye.